Welcome back. Well, the National Health Department says it's now looking for around 500,000 people that it needs to pay out. They're suffering from silicosis, asbestosis, and tuberculosis, which they may have contracted while working underground as a miner. The fund to pay out these miners has around 10 billion rand in it. As I understand it, 5 billion rand of that comes from mining companies. They were taken to court in a class action suit by mine workers several years ago. Dr. Sibongiseni Dhlomo is the Deputy Minister of Health. Deputy Minister, good afternoon to you, and thank you very much indeed for your time. How does this fund actually work? What's the aim of it?
Good afternoon, Stephen, and good afternoon to your viewers. We are a tripartite departmental group. We were together with Deputy Minister Moloi from Employment and Labour, Deputy Minister Kabane from Mineral Resources and Energy and Health, because it's just more than the things that we mentioned. There are South Africans and probably citizens of SADC who came into our mines and worked, and because they felt a bit sick, just told to go home because Teba was going to actually recruit somebody else the next day. And those people are out there devastated without any resource. So it's not only just for silicosis, asbestosis, TB, any other ex-miner who was a worker there and has not been fairly given what is responsible, even if it's pension. These were able-bodied men who left their areas with Libode, Port St. John's and Mzimkulu, and they're in the 70s. They're not able to actually access these funds, and that these funds are there. And then again, the banks would probably be raising these issues with them as to come and collect the money. No, what is happening now is these tripartite departments reaching out to the citizens of SADC, including where we are in KwaZulu-Natal this time around in Nongoma, where we were met by 9 Amakosi and over 100 Izinduna headmen, and people were there already starting to write down and give their details. No, but we're coming next week. For now, it was just to sensitize Amakosi and Izinduna that we will need to see all their people, all the subjects coming in, the clients who will be clients of these departments to come and register. Even if your parent Stephen passed on and there's evidence he worked in the mines, please bring those documents so that we can appropriately compensate. Some of them for illnesses, others it's just pension that is due to them that was never claimed.
As I understand it, the mining companies are paying around 5 billion. The fund is 10 billion. Is that right? I mean, is government paying the other half?
No. This other 5 billion is for the class action that were taken through court, the settlements. This is 5 billion just from one Shiamiso trust. The other 4.5 to 5 billion is due to the ex-mine workers as pensions that must actually be collected. Some of the compensations must come from, we have one department, health is going to pay about 1 billion for the compensation of these illnesses that we already have received. Some of the mine industries put money into health for looking after this and that citizen, and therefore that money is sitting in our kit as 1 billion rand. So the other 4.5 billion is pensions due to them, which then they will actually have to afford. But the other 5.5 billion is actually the lawsuit that came around for these settlements to have been to be paid for, and that money is ready. So it's almost 10 billion ready to be dispensed to our people, not only just in Nongoma where we come from, but in the whole of SADC. The majority of that will be Eastern Cape, where they have about 200,000 former mine workers. Of course, fortunately, some of them have already received their payments, followed by Lesotho, another 150,000 ex-mine workers, Mozambique, another 100,000, and Northwest, another 90,000. Then it goes right across Malawi, Zimbabwe, Botswana, and all other provinces, largely the belt that is starting in from Northern Cape, Northwest, Mpumalanga, KwaZulu-Natal. But you will recall that Teba was all over our country, even in the other neighboring countries. So the biggest ever, it came from Lesotho and the Eastern Cape.
Okay, now that all makes sense. It's going to be quite difficult speaking to Amakosi and KwaZulu-Natal now. Are there going to be proper efforts in other countries? I mean, Malawi, Zimbabwe, for example. Are we going to have a proper means of trying to get hold of workers and their descendants and their families?
Fortunately, 5 months ago, I was in Mozambique, welcomed by the former president, President Chisano, and they have already a cohort of former mine workers. They formed themselves into councils. Very fortunately, these structures are there. We just go in there and strengthen them. We announce we are coming in, and then we put like a marquee, a big marquee, and people come forward and register. What is very fortunate now, Stephen, is that when you come in there and you are saying, but I'm Stephen, my father worked in the mines, and here are the documents, the death certificate, he was admitted in this hospital for TB. All that is recorded, and there's no dispute in the family whether it should be Stephen or Stephen's grandchild who must register for the compensation. The banks are there. We bring all the major banks. They are there. You could pick and choose which one you want to register, and the money is paid. Sometimes even before you go home, the money will land into your bank account. So others will register, but for me, who still has to be checked and confirm that yes, it is silicosis, what the severity, and then the experts will then look into that, because we bring all sorts of machines, the spirometer, where you have to push and see the affectation of the lungs, how obstructive is the disease, all that to be assessed, and therefore you'll be compensated. Well, we argued with it. In fact, we argued with the Mineral Council, which is called former Chamber of Mines, to say, but it is not correct medically to discharge me this month out of work, and already I have got silica dust in my lungs, which is not giving me any problem now. But silica dust progressively gives me a disease in 3 years' time, and you are not ready and available to pay me. And you said you gave me a clean bill of health when I left. This disease is progressive, and it is progressive beyond just being an employment. On the basis of that and that alone, that is why the trusts are there now. They have to compensate those people that today we pick up that they've got silicosis, TB, asbestosis, which was not there 7 months, 10 years ago, because when they discharged, they were looking like healthy, but yet they were not.
Obviously, it's a difficult thing to do. It's a big thing to do. It's a lot of money. Are you going to be able to make sure, absolutely certain, it all goes to the right people? You've said that the banks will do their own checks. You'll do your own checks. People will need to bring proof that they or their fathers, I presume their fathers generally, worked in mines. I mean, people will need to prove that they actually are owed this money.
Stephen, we are not starting from new. We are not starting from scratch. This process has been there. It's about 4 or 5 years now that it started at the time Minister Oliphant was and Minister Mtwaledi. They were in health and employment and labor. We are just accelerating it now because really, number two, when you go there as a Department of Labor and Employment and you do a bit, is not enough, because if somebody else has to be then examined, medically assessed, you say, no, wait, we'll go and tell the Department of Health to come back some other time, and they maybe will never come back. Mineral resource, and there are issues that they must bring also on board. So we are now this tripartite department. We are going to accelerate. So when everybody has been done here on this desk, they move to the next table and they get to be checked, confirmed by the Department of Health, the next table, mineral resource and energy, and this side, employment and labor. So in one-stop shop, all departments that are affecting the workers are there. The banks are next door, opening the bank account, so it's done. So it's not something we're starting now as we started to want to accelerate, because if you go and pay someone in Shai, we have not done enough for somebody waiting in Port St. John's and somebody waiting in Da'a. Now you have to really get going quite fast. Majority of these people are now grandfathers. And in fact, when we went to Northwest and we started paying, somebody was saying, please pay. This money is not going to assist me now, but it's going to be a legacy for my family that I once worked in the mines, and what is going to remain is for my children. I'm not going to have many more years to live on. People appreciate, and we are actually calling this program a poverty alleviation program for the former mine workers, and it does alleviate. We have evidence in some communities where this has happened, especially in the Eastern Cape and Lesotho.
Deputy Minister, I really appreciate the time. Thank you. The Deputy Minister of Health there, Dr. Sibongiseni Dhlomo.